Today we are going to talk about the calcaneal spur. The spur is a bony protuberance that forms in the calcaneus, that is, the heel bone, usually due to an accumulation of calcium. We can distinguish between two types of spur, and more specifically, the plantar spur, that is present at the lower part of the calcaneus, or a posterior spur, that is at the level of the insertion of the Achilles tendon. These two types of spur can be present in isolation or be present at the same time. In this video, we will discuss the plantar calcaneal spur, i.e., the one under the heel. It is critical to understand that the plantar spur is almost always not the cause of pain, but rather the result of chronic inflammation. Talking about the causes, we can say that spur often develops as a consequence of 1. Plantar fasciitis, i.e., inflammation of the plantar fascia, the fibrous tissue that extends from the heel to the toes. Chronic inflammation of the plantar fascia can stimulate spur formation. Acute heel pain, especially when walking or putting weight on the foot. When the plantar fascia is subjected to repeated tension and stress, it becomes irritated and can cause micro-injuries where it attaches to the calcaneus. This process stimulates calcium accumulation in the area, leading to spur formation. We therefore reiterate that it is critical to think of the spur not as the cause of pain, but rather as the result of inflammation that has been going on for some time. 2. Flat foot or high-arched foot. These biomechanical abnormalities can increase stress on the muscles and ligaments of the foot. 3. Overweight. Extra weight can increase pressure on the heel and promote spur development. 4. Inappropriate shoes. Footwear without adequate support or cushioning can put stress on the foot. 5. Reduced elasticity of the calf muscles or Achilles tendon. This occurrence results in continuous tension on the plantar fascia, which will then experience chronic inflammation. Symptoms that bring the patient to the doctor may include 1. Acute heel pain, especially when walking or putting weight on the foot. 2. Swelling and irritation of the lower heel. Sensation of pin and needles can be felt under the heel, especially in the morning or after resting. How to diagnose it? As always, the diagnosis comes through the collection of the complaints complained of by the patient, clinical examination, and possibly instrumental investigations such as blood tests or radiological tests. The main steps in the diagnostic process are 1. Past medical history. The physician will gather information about the patient's symptoms and medical history, such as the duration of the pain, any activities that make it worse, and pre-existing medical conditions. 2. Clinical examination. During the clinical examination, the physician will assess the location of the pain, usually under the heel, the presence of swelling or redness in the area, as well as sensitivity to touch or pressure on the bottom of the foot, especially near the insertion of the plantar fascia at the heel. 3. X-rays. This is the initial examination, but it must be done under load, i.e., standing, to better define the orientation of the joints when stressed by weight force. MRI scan is less frequently requested, but it may be useful if pain is suspected to be caused by other conditions, such as a stress fracture, tendon injury, or joint inflammation related, for example, to osteoarthritis. Ultrasound can help to see the status of the plantar fascia, while MRI can provide a detailed image of soft tissue and bone structures. Ultrasound is an overall less precise examination than MRI, but it is more expensive for insurance. Although the diagnosis is generally easy, there are cases when the pain is caused by other, less frequent issues, such as 1. Bursitis, which is lymph inflammation of the bursa, a small sac containing fluid that cushions bone and joint structures. 2. Stress fractures. They are a small crack or break in a bone caused by repetitive overload or stress, rather than a single violent trauma. This type of fracture develops gradually over time when the bone is unable to repair the damage caused by repetitive activities. 3. Neuropathy or nerve disorders that can cause heel pain. Specifically, the Baxter's nerve can become irritated or compressed, causing a condition known as Baxter's nerve syndrome or inferior calcaneal nerve entrapment. This disorder can lead to pain in the heel area, which is often confused with plantar fasciitis, as the symptoms are similar. Treatment of Spur depends on the severity of symptoms and the underlying cause, such as plantar fasciitis. Here are the main treatment options. 1. Rest and changes in activities. Avoid activities that worsen heel pain, such as walking or running on hard surfaces. 2. Avoid walking without shoes and avoid using flat shoes such as flip-flops or flats. 3. Ice packs and compressive bandages. Applicate ice on the painful area for 10 minutes, several times a day, to reduce inflammation and relieve pain. Using a compression bandage can help reduce swelling. Anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, such as ibuprofen or naproxen, are often used to reduce the pain and inflammation associated with plantar fasciitis. 5. Orthopedic insoles that provide arch support and heel cushioning, reducing stress on the plantar fascia and heel. 6. Heel cushions or shock-absorbing insoles can be inserted into shoes to better distribute weight and relieve pressure on the heel. 7. Physiotherapy, particularly to perform plantar fascia and calf stretching, but also to perform shockwave sessions. 8. Stretching exercises. This is undoubtedly the best method for reducing pain in the vast majority of cases. There are many types of calf stretching, but I recommend only stretching as you will find illustrated in the link at the end of this video. 9. Massage and manual techniques such as plantar reflexology to reduce inflammation and improve circulation. 10. Acupuncture. Can be considered to relieve chronic pain. 11. Taping. Application of special bandages to support the plantar fascia. 12. Cortisone injections. In cases of severe and persistent pain, corticosteroid injections may be used to reduce inflammation around the heel. However, these injections are generally used with caution because of the risk of side effects, such as tissue weakening. 13. Shockwaves therapy. Shockwave therapy is a non-invasive treatment that uses high-energy sound waves to stimulate healing of damaged tissue and reduce pain. 14. Weight loss. Maintaining a healthy body weight reduces stress on the feet, improving symptoms. What to do if all conservative methods do not work? Most cases can be managed with conservative, i.e., non-surgical methods, but in rare cases, if the pain is persistent and severe, surgery may be necessary. The surgical option is extremely infrequent and is generally never considered until the conservative option has been tried for at least 6 months. If you would like some information on the type of surgery that is performed in these cases, I invite you to click the link on plantar fasciitis that you will find at the end of this presentation. So what conclusions can we draw? 1. The heel spur is a much more common condition than we think, being able to affect even people who have no symptoms at all in their feet. 2. The bone spur is the consequence of chronic inflammation that very often results from functional overload due to reduced elasticity of the calf muscles. 3. Most patients respond well to conservative treatments. 4. The most effective approach includes a combination of rest, physiotherapy, orthotics, anti-inflammatory drugs, but most importantly, a calf stretching program. 5. Surgery is rarely necessary and is considered only as a last resort, only after trying conservative treatment for at least 6 months. Thank you for subscribing to the channel and sharing the video if you find it useful.